In Scotland today, there is an increasing expectation that people will be actively involved in looking after their health and managing their healthcare and treatment. We expect people to self-manage their health condition, illness or disease at home, take medicines as prescribed, follow treatment instructions accurately, make informed decisions about their healthcare, treatment and medication. We expect people to navigate an increasingly complex NHS and health and social care system, understand medical jargon and abbreviations, understand letters, booklets and leaflets produced by the NHS and other health and social care organisations.
I won't go to the doctors unless there's a list of things wrong with me, because they make me feel little for not understanding what they're saying. It's like they're talking to another doctor and they'll use the terms that's in the book.
I mean, patients need to be involved in their own decision making about their own health. Healthcare is essential. I see a lot of patients with chronic lung disease. We try very hard to help and assist those patients and empower those patients to self-manage. And the key central part to that is being able to communicate what it is to the patient that will be in their best interest to help empower them take control of their own condition.
In Scotland today, we know from evidence that more than half of our population struggle to understand the informations that clinicians and health and social care staff discuss with them, and only 25% of that information is remembered correctly.
There have been some studies that suggest that about 50% of what a person hears in a consultation is forgotten, and 50% of what is remembered is often misinterpreted.
This ability to access, understand and act on health information is called health literacy. Making It Easy is the Scottish Government's Health Literacy Action Plan. This film features patients, clinicians and health and social care staff talking about health literacy.
I think it can be tricky to work out which patients you see have fully taken in what you've said to them and have fully understood the information that they need.
Sometimes when you think you've explained something really, really well and you get somebody to come back for a follow-up, they'll tell you something completely different.
The patients come to me quite often when they come from the doctor's surgery. They'll come and say, I just didn't understand what the doctor was talking about. Could you phone them? Or I'll say, I'll phone them and I liaise with the doctor, get the information and tell it to the patient.
Everybody uses jargon and I get annoyed, so I always say, can we have this in English, please?
Well, if you don't understand a doctor, you usually just go home and you look up on the internet or ask people around. You just ask for their advice and you sometimes end up self-medicating. You feel quite silly asking questions to the doctor because you don't know if it's going to be an appropriate question, or you feel like probably the doctor will tell me an answer he's already given me, or you just feel shy about it.
I'd had blood in my stool over a few days. I knew I was worried, and all the messages are blood, bowel cancer, doctor. So I went to my GP. I'd got myself a bit constipated, she said, still doing a lot of travelling and out of routine at work. I didn't worry. I went back and then I was sent for tests. The doctor said this has been going on for too long, and I was sent for a colonoscopy and got my diagnosis. Actually, the consultant could feel my tumour immediately. And I remember that one of the questions that she asked me was, is it fresh blood? And I thought, oh, fresh, what exactly is she asking me? And then I thought, well, if you cut your finger, it runs. So I thought, well, it's liquid. So I said, yes, it was fresh. And it was only after my diagnosis and when I got my notes, I saw that it said bright red blood merged with the stool. And I thought, that's what she was asking me. So we really didn't communicate at all, and neither of us were aware of that.
The modern NHS and health and social care system in Scotland is extremely complex to navigate, and communication can be hard to understand. This can undermine people's confidence and cause embarrassment, confusion and misunderstanding. It can also lead to missed appointments, medication errors, misdiagnosis and poorer health outcomes.
It can have some quite serious consequences. I guess one of the things that may happen is that they go off and seek information elsewhere rather than admit to the health professional they haven't quite understood.
If patients don't understand fully that the information that we've provided, it can delay wound healing, and also that has an effect on staff, management, etc., because we end up having to visit the patient perhaps for months, whereas if they understood the information, the wound probably would have healed much sooner and less resources are used.
I think it's important for lots of different reasons. I mean, a main one would be safety. If a patient doesn't understand what you're discussing with them in terms of the medicines that you're recommending that they take, what the potential side effects might be and when to report those. Also, it's very important for consent. Unless somebody understands exactly what you're talking to them about, then they can't genuinely opt into that process.
I'm HIV, so learning to take the HIV medication, learning the names of them, because they do have 3 or 4 different names. Understanding the medication, you just don't, you just wing it. And hopefully you get a good consultant or a good doctor that's able to explain things to you, but sometimes you don't. I used to take a drug called Cystiva, which also has a clinical name of DMP 288, I think it is. And it's also called evavirenz. So if you don't understand it's the different names, but it's the same drug, that can be really confusing. And that has happened to me a couple of times.
An example from my experience of when I was given information that I wasn't sure how to interpret or that I didn't understand was when my daughter was very young. She had lost a lot of weight, and when I was breastfeeding she didn't seem to be putting any weight back on. And so the health visitor was really concerned and advised me to start giving her a formula. And I assumed that that was by a bottle, but I learned later that it should have been like with a syringe or a different method so that she wasn't getting confused between bottle and breastfeeding. I was quite frustrated because her getting confused between bottle and breastfeeding led to her preferring the bottles and not wanting to breastfeed.
I got a letter and I had to go to general surgery, and I'm looking about daft in the hospital for general surgery on the signs, and there was no sign saying that. So I went up and asked, and they showed me on the top of my letter it had outpatient department 1. It was shown on the sign as OD1, but no one explains that on the letter, so I felt really confused and silly.
The instructions on like a leaflet, for instance, I won't be able to read that because it is just crammed with words and letters and information, and it's good if there's a picture on it because you can visualise that. And again, if you're getting told you have to take this medication so many times a day, and maybe ask the doctor to repeat herself a couple of times, and I'm going, I'm really sorry, I didn't be rude, but you know, I'm dyslexic, but I'll bring it up the road again. I'll say to my parents, look, you need to tell me what time that says and when I have to take it, because I don't want to overdose, obviously.
Take the example of warfarin. If patients don't understand why they're taking warfarin, then it can be very dangerous. It can have side effects, consequences for them, and so you want them to understand completely why they're taking it. And I also think it's important because it empowers them. It gives them ownership of their disease. It helps them to understand the management of their disease, and therefore I think it is managed more effectively if the patient understands what they're doing.
Clinicians and health and social care staff have a key role to play in improving health literacy in the way they communicate with patients and carers. The Patients' Rights Scotland Act 2011 states that people should be communicated with in a way they can understand, and healthcare staff should make sure that patients have understood any information given. There are a number of simple and easy to use techniques that can be used to improve health literacy and patient understanding. Use the teach back technique.
Asking people if they've understood often isn't good enough, and that's something that we all tend to do. We all use the question, that closed question, did you get that, did you understand that? And I think patients are very likely under those circumstances to give you a positive response, which isn't always appropriate.
To ensure that patients understand what it is that maybe we've talked about in a consultation, I will ask them to teach back to me what it is that we've covered. So it's summarising the main points of the consultation, any action points that we've agreed upon.
I would usually ask them to repeat back to me what I've said. But I will say to them, so can you explain to me what the doctor said your condition is and why he would like you to take this medicine or why he's recommended this medicine for you, and ask the patient to put it into their own words.
What you really want to do is get them to relay the information back, and I would suggest that we all need to do that all the time, because otherwise you will never absolutely know whether the patient has understood what you're talking about. So for the next couple of weeks I want you to take 2 milligrams and 3 milligrams every other day. So what you want to do is, on tonight I want you to take 2 milligrams, so that's 2 ones, okay?
Yeah.
And then tomorrow you'll take 1 3 milligram tablet, okay? So
yeah.
You've got ones.
Yes, I have, yeah.
And you've got 3s.
I have indeed,
all right.
yeah.
And then if you make an appointment to come back to see me in a couple of weeks, would you manage to do this yourself, or do you want me to help you to write it down?
I can manage fine, thanks very much.
Fine.
Yeah.
All right, so just give me an idea, just make sure that you understand what I've told you.
To get this correct balance that we're trying to achieve, you want me to take 2 milligrams one day, 3 milligrams the following day, alternate days. And that's what I'll do, and I'll write it in the book as you say, so that I don't lose track of where I'm at.
And you're coming back when?
A fortnight
to get time. So that's
check.
Absolutely great.
Chunk and check information.
I will break down the information into small chunks and give very direct information, very clear, no lengthy words, very concise and precise. And I will always repeat myself and make sure that I got an idea that the patient is able to follow me.
Use pictures and diagrams.
The other things that I will use in consultation sometimes are diagrams, so drawings. Sometimes if I've gone through some breathing exercises with the patient, for example, we'll have maybe drawn a diagram together and worked through the diagram so that they have something that they can refer back to.
Use simple language.
I suppose in clinical environments we all can be quite guilty of using, jargon, of using medical terms. I think it's about making sure that what you're saying is fully understood, and it's not just terms that go over the patient's head.
I think using jargon should be avoided, using acronyms should be avoided, and also translating into the language that you would expect a relative of yours who doesn't have experience in health or social care to understand.
Routinely ask people if they would like help filling out forms.
We would ordinarily help a patient fill out a form. If they're coming to an interview and the forms are proving difficult, we'll sit with them and fill that form in with them. And it's important that the key information is there and it's made easy for the patient so that we can move ahead with the healthcare intervention.
Scotland's ambition is to be a health literate society which enables all of its citizens to have sufficient confidence, knowledge, understanding and skills to live well on their own terms and with any health condition we may have. All those working in the NHS and health and social care have a role to play in improving health literacy. Making it easy shows us that we can improve health literacy, we can achieve our ambition, and we can make a difference to the health of people in Scotland today.